Hi, my name is Hannah Aldridge, and I'm going to be showing how to properly do wound irrigation and dressing change. So the first thing I would do is I would review the patient's health record to see if they have any prescribed wound care or anything like that. Look at the nursing care plan. I'd also perform proper hand hygiene and make sure that I put on any PPE that's indicated, anything like that. I identify the patient when I'm in the room, assess the patient to see if they need any pain reducing interventions or anything like that. And if so, I would give that to the patient, administer the appropriate amount of that, and then wait for that to kick in before I start my process. Then I would close the curtains around the bed, give the patient some privacy, close the door to the room if possible. And then I would tell the patient what I'm going to be doing today and all of that stuff and why I'm going to be doing it to the patient. So then I would make sure that my wastebasket is next to me for all of my disposables that I'm going to have to be throwing away. Then I would I already assembled all of my equipment onto the bedside table that I have here to set up my sterile field and to properly do the wound irrigation and dressing change. So then I would put my bed the patient's bed into a proper position wherever they're comfortable, and make sure that they are also in a position to where the wound, when it's getting irrigated, that it's going from top to bottom or from the irritated part of the wound toward the bottom. I would do all of that. And then I already placed a waterproof pad underneath my wound. I'll show you my wound really briefly. And I will be moving my video just to show what I will be doing. So I have my sterile field here and my wound is on the bed, aka on the patient. So the first thing I will do is I will check the positioning of the patient's tubes or drains or anything like that, and make sure that I remove that before removing the dressing, or I would check that before removing the dressing. The first thing now I'm going to do is I'm just going to put on clean disposable gloves first so that I can loosen the tape of the old dressing with clean gloves on. And I will be doing that by using the push and pull method to take off any tape that is around the wound. Doing the push-pull method, lifting the corner of the dressing away from the skin. And I would continue moving my fingers around on there. I'm just gonna move it up here just to show what I'd be doing. I'd be pushing taut onto the skin while I pull the tape off. Push and pull, push and pull, push and pull. That's what I would be doing. And then with the dressing area, I would remove the sides first and then the center. And then I would dispose of this properly. So now here is my wound. I'm going to put that back over here. That was just for reference. So I removed the soiled dressing. Now I'm going to assess the wound carefully, noting the presence, the amount, the type, the color, anything like that, and the odor of the dressing, anything like that it could possibly be having. Then like I said, I put the dressing into the waste receptacle or the waste basket. So now that I have assessed the wound, I would measure the wound, and I have a measuring stick here I could use. I would measure the wound. And then after I've done all that, I can remove my gloves and throw them away. And I would, of course, perform hand hygiene. Now what I will do is I will set up my sterile field. So I will start by doing that by grabbing my drape, opening it away from me, and placing it down here. Now I can grab within the 1-inch field. Let that open up. Don't let it touch anything. I can dispose of this now. And I'm going to open this up, turn it this way, and slowly let it drop down. Not reaching over my sterile field, making sure that it is properly set up. There we go. Now that I've set this up, I'm going to put all of my supplies on there. And I will pour my sterile solution into the sterile container.